The adrenal glands are located just superior to the kidneys. And so we could see, obviously, the right kidney here and the left kidney. But just on top of that are the adrenal glands. And within the adrenal glands, there's actually two groups of tissues. The adrenal medulla is different than the adrenal cortex. So we're going to talk about them kind of separately. We're first going to talk about the adrenal cortex, the outer region of the adrenal gland, and it has three different layers. You should know the three different layers and the hormone that's being produced. Collectively, all of them are called corticosteroid hormones, and specifically, the layers all begin with zona because they are zones. So you just need to remember to be able to recognize the name. So it may help you to remember what letter it begins with. So for the outermost layer of the adrenal cortex, we have what's called the zona glomerulosa, and it produces hormones called the mineralocorticoids, and that primary hormone is called aldosterone. So I'm going to start by just listing the first letter of the layer and the hormone. So we have the glomerulosa, which produces mineralocorticoids, and the most common is called aldosterone. The next layer, the middle layer of the adrenal cortex, is called the zona fasciculata, and it produces a group of hormones called the glucocorticoids. And those would be things like cortisol or corticosteroid. As far as what they do, look, if you just look at the first part of the word, it kind of tells you. It looks like the word glucose, which is blood sugar. So these hormones are collectively going to increase the blood sugar. Aldosterone is going to cause sodium reabsorption. That means that sodium is going to return into the blood. And as I'm sure most of you know, that when we have more sodium, it increases our blood pressure. So one of the risks for high blood pressure is having lots of salt in your diet. The innermost layer of the adrenal cortex is the reticularis, which produces gonatocorticoids, that which is androgen. And androgen would be basically testosterone. So this is a reason that females have some testosterone in their body because of their zona reticularis. So in the second layer, we have the zona fasciculata, which secretes glucocorticoids, and the main one being cortisol. In the innermost layer of the adrenal cortex, we have the zona reticularis, which secretes gonatocorticoids, and the most common would be androgens. So these lists of letters may help you to remember the name of the layer, or at least recognize it, because after all, the quizzes and the exams are not fill in the blank. They're multiple choice questions, so as long as you can recognize it. So we have the glomerulosa, which makes mineralocorticoids, and that most common one is androgens. We have the fasciculata, which produces glucocorticoids, the most common being cortisol. Then we have the reticularis, which makes gonatocorticoids, and the most common would be the androgens. So let's look at an image of the adrenal gland here. We can see the outer adrenal cortex, which is essentially going to be endocrine tissue because it's going to be ductless glands that secrete hormones into the blood, whereas the adrenal medulla is actually nervous tissue, and it's an extension of the sympathetic nervous system. So let's look specifically in this case at the adrenal cortex. So the outer layer is the zona glomerulosa, and that secretes mineralocorticoids. And the main mineral that is being affected here is sodium, which is reabsorbed by aldosterone to increase blood pressure. We then have the zona fasciculata, which secretes glucocorticoids. So it's going to affect glucose, and the most common would be cortisol. The innermost layer then is the zona reticularis, which secretes gonadocorticoids. So this tells you what target tissue it has with the gonads, and the most common gonadocorticoid is the androgens. So you should be able to recognize the three different layers, either on a diagram like this or on a micrograph like this. You'll notice that the thickest layer is always the zona fasciculata, and that's what secretes the glucocorticoids, which is cortisol. Next to the capsule, we have the zona glomerulosa, which secretes mineral corticoids, the most common of which is aldosterone. And then the innermost layer is the zona reticularis, which secretes gonadocorticoids, and the most common being androgens. In the innermost region of the adrenal gland is the adrenal medulla, and it's going to look a little bit different. And remember, it is nervous tissue. It's an extension of the sympathetic nervous system. So there's actually nerves that come directly out of the spinal cord, which lead to the adrenal medulla. And the adrenal medulla then is going to secrete norepinephrine as well as epinephrine. So the adrenal medulla is the gland's inner core. And the word medulla means inner part of an organ. The word cortex means outer part of the organ. Secretes norepinephrine, which is abbreviated NE, and epinephrine, which is just abbreviated as with an E. And it's involved with the fight or flight response of the sympathetic nervous system. So whenever the body needs to go into fight or flight mode, the hypothalamus is stimulated, and that's going to automatically cause the adrenal medulla to secrete norepinephrine and epinephrine. And those two hormones are going to prepare the body for emergency situations like prolonged fight or flight responses.